I will show you a live diagnosis because number one, before we proceed to any session or any therapy for the hair, we have to have a proper diagnosis. For young patients, 20 to 25, prevention is even more important than to undergo a session.
What is the most reason of the young age losing hair?
First of all, it's the genes. So it's a gene that comes from our mom and it goes many, many years ago. Number one is this, and then it's the everyday life, the anxiety, the stress that we have in our everyday life. So what we can see here is the quality of his hair, of his donor area. As you can see, we have thick hair. She will count the thickness as well from its hair, but you can see thick hair and grafts with many hair. And they come here because we have preservative treatments as well, the PRP, the plasma. Yes, of course you know PRP for other reasons, but it helps a lot for the hair as well. It helps a lot.
We don't need right now, obviously, but can you tell that?
I can say
when do you
for
think
sure.
that he will need?
Exactly. I can say for sure that in 4 or 5 years he might need something only on the temples, but generally, even the quality, when you touch the hair, you can see that he has the same quality at the back and the same on the top. So this is a very good sign for him that he will never, ever, ever be totally bald.
Good for you then. Good. That's nice.
Where do you get the hair from? Where?
The donor area is the back of the head, from one ear to the other, the whole back.
Okay. Awesome.
And we implant according to the alopecia issue. If it's going to be only temples, it's a very small session. If we have to cover everything, it's going to be a bigger session.
Approximate time of, getting something?
It depends. We need about 2 hours to extract the hair and about 2 hours to implant. If we have bigger sessions, we can go up to 6 or 7 hours. But it's with breaks in between. Lunch break, if he feels, if he needs a break to stretch or whatever. So more or less it's going to be about 6 hours of a session.
6 hours and, for the hair to come out again, like...
It's going to take in 6 months. You have a nice result. The final one will be in 1 year.
1 year.
Definitely a good experience, I have never been in such a clinic like this before. So that's why I think it was definitely a good experience for me, just to learn how everything goes, the time that it took, and obviously, I had a chance to see the patients, and how everything works. But yeah, definitely a great experience.
DHI, what is the 10th month?